So next one is fracture. What is fracture? What is fracture? Fracture. What is fracture? Yeah, analgesics we can give. Monica, very good. Analgesics, we can give analgesics. If there is severe pain, we can provide analgesics. Okay. What is fracture? Break of bone. Break of bone. Break in continuity of bone. What is that? Break in continuity of bone, that is called fracture. What is fracture? Break in continuity of fracture. Break in continuity of fracture is called, sorry, break in continuity of bone is called fracture. Break in the continuity of bone, that is called fracture. So what are the type of fracture? Simple fracture, open fracture, closed fracture, compound fracture, comminuted fracture. Okay, so there are different types of fracture. Different types of fracture according to the site of site, according to the communication with the outer surface and open and close, isn't it? According to the nature, according to the location. So there are different classification. Okay, fine. So we can see one by one. So first one is simple fracture, or we can say closed fracture. Simple or closed. And skin is intact. Skin open raledu. Skin is in, now it is still closed. Skin is intact. But fracture akkada local fracture ayindi. Local fracture ayindi, but skin inka open avaledu. That is called simple fracture or closed fracture. Appudu open fracture ante enti? Skin open ayindi, bone baita ochindi. Okay, skin bone is exposed outside. Exposed outside. That is compound fracture or open fracture. Okay, and yes, very good, Rajshekhar. Spiral, oblique, transverse, compression. Okay, fine. We'll see one by one. We'll see one by one. What are they? What are they? Yeah, communicated fracture or comminuted fracture. What is comminuted fracture? Communicated fracture or comminuted fracture. What is that? Okay, so here in this picture, can you see here what happened here? Fracture ayina space multiple fracture. Am I in the multiple fragments, multiple fracture fracture ekkada ayindi okate area la ayindi. But what happened? Bone fractured into multiple pieces. Fractured into multiple pieces. That is called comminuted fracture. That is called comminuted fracture. What is compression fracture? Compression. ఒక బోన్ ఇంకొకటి బోన్ ని కంప్రెస్ అయింది, ఫ్రాక్చర్ అయింది. వాట్ ఇట్ ప్రెస్సింగ్ వన్ బోన్ ప్రెస్సింగ్ అగైన్స్ అనదర్ బోన్, కంప్రెస్డ్ ఫ్రాక్చర్. అప్పుడు ఆ జాయింట్ దగ్గర ఏమైంది? ఫ్రాక్చర్ అయింది, కంప్రెస్డ్ ఫ్రాక్చర్. అర్థమైందా లేదా? ఐ గాట్ ఇట్. దెన్ డిప్రెషన్ అంటే ఏంటి? డిప్రెస్డ్ ఫ్రాక్చర్ or depression fracture. Depressed fracture. ఫ్రాక్చర్ అయింది, బోన్ అక్కడ నుంచి ఇంకొకటి ఆర్గన్ పెనిట్రేట్ చేసిన. దట్ ఈస్ కాల్డ్ వాట్? డిప్రెస్డ్ ఫ్రాక్చర్. ఏం ఫ్రాక్చర్? డిప్రెస్డ్ ఫ్రాక్చర్. నెక్స్ట్ ఏంటి? గ్రీన్ స్టిక్ ఫ్రాక్చర్. వాట్ ఈస్ గ్రీన్ స్టిక్ ఫ్రాక్చర్? ఇట్ ఈస్ అ కామనెస్ట్ ఫ్రాక్చర్ ఇన్ చిల్డ్రన్. What is the commonest site? What is the commonest site of green stick fracture? Commonest site of green stick fracture. Commonest site. Suppose if it is in the ulnar area. Suppose if it is in the ulnar area, what happens? Ulnar area fracture happens and radial area bend happens. Got it? How? Like this. This area fractured and this area bend. This area bend. Same way, most commonly it can happen to this bone. What is this bone? Carpal or metacarpal? This bones. So what is this bones? See, this is what I said. Lack of concentration. Lack of concentration. Meeku telusu. But what question was simple? Question was simple. Em chesina? Tappu chesina. It became wrong. But you didn't know that. You didn't know that it was a wrong. తెలియలేదు అది రాంగ్ అంట. ఇంకా చాలా టైం చెప్పిన సార్ ఇదే సార్ ఇదే ఏంటి కార్పల్, అప్పుడు ఇదేంటి సో దిస్ ఈస్ మెటాకార్పల్. ఓకే, కార్పల్స్ ఎక్కడ ఎక్కడ ఓకే, టార్సల్ ఎక్కడ joined, angle joined. Metatarsal ekkada? Okay, so never make mistake. See, keep in mind, when questions are simple, very high chance for making mistake. Avuna leda? Manam think cheyaledu. Simple, wow, simple question. And option kuda first ade undi kada, carpal undi, first option ade, stick chesina. ఓకే, డ్రాప్ చేసిన. ఇప్పుడు సిబిటి అంటే క్లిక్ చేసిన, మళ్ళీ ఆన్సర్కి అయింది. అరే మనం ఏం చేసినా తప్పు చేసిన. సో ఇట్ ఈస్ హ్యాపన్స్ వెన్ క్వశ్చన్స్ ఆర్ సింపుల్, there is high chance for making mistake. Okay, fine. So either in the ulnar area or in the metacarpal area. These are the most commonest area for green stick fracture. Children are very frequently, they will fell down. Avuna leda? During the fell down, what they will do? They will first place their arms. So obviously there will be fracture. That is what? It is common in children. And one side fracture, the other side is bending. Yeah, one side is bending, other side is fracture. Why? Because see, listen here, this thing, see, only one side it is fracture, one side it is fractured, other side ఏమైంది bend అయింది. Got it? It is a incomplete fracture. Green stick fracture is a incomplete fracture. So keep in bracket, it is an incomplete fracture. What is complete fracture? What is incomplete fracture? కంప్లీట్ అంటే కంప్లీట్ గా బోన్ ఫ్రాక్చర్ అయింది, సెపరేట్ అయింది. ఇన్కంప్లీట్ అంటే సమ్ పోర్షన్ ఫ్రాక్చర్ అయింది. ఓకే, గాట్ ఇట్? సో దెన్ oblique fracture, spiral fracture. See, listen here, see this one, the shape చూడండి, చూడండి, ఇక్కడ నుంచి ఇట్లా స్పైరల్ గా, నాట్ ఏ రౌండ్, ఎట్లా ఇక్కడ నుంచి స్టార్ట్ అయ్యి ఇట్లా. What is spiral shape? What is that? Spiral. Okay, entire spiral shape fracture. Fracture ekkada start ayindi, ikkada start ayindi, ikkada end ayindi, or ikkada start ayindi, ikkada end ayindi. మామూలుగా ఇట్లా ఫ్రాక్చర్ అవుతుంది. ఇస్ ఇట్? అవునా లేదా? సో ఇప్పుడు ఏమైంది, పైనుంచి కింద. వాట్ ఇస్ స్పైరల్ షేప్. దెన్ వాట్ ఈస్ segmental fracture? There is multiple fracture in a single bone and a segment, and there will be pieces. There are pieces, multiple pieces in between the fracture. Got it? See, this one can be moved out, isn't it? Entirely the bone fractured. Got it? Okay, that is what called segmental. What is closed fracture? Already we discussed. Skin, no injury in the skin, but what happened? Bone is fractured. spiral అయింది. Linear. What is linear? Single line. Single line. Single line. Only a line. Hairline fracture. Hairline. What is our hairline? అంత తిన్నుగా సన్నగా ఏమైంది? ఫ్రాక్చర్ అయింది. Like a line. Like a line. Like a drawing line. Like a hairline thickness. That is hairline fracture. Got it? Got it? Transverse fracture. What is transverse fracture? Transverse fracture. What is transverse fracture? Like a horizontal way. Ana leda? Okay, fine. Got it? Okay, fine. And there are some other fractures, special fractures. Special fractures are there that is named by the doctors or the physicians or the orthopedicians or the surgeons who discovered it, who find it, who find the fracture. They named the fracture after their name. Got it? Avaru peru kuda aa fracture ku istindi pettindi. Okay, peru pettindi. Avaru doctor peru kuda pettindi. So there are some special fractures we can see. Okay, already we discussed this one. Pathological fracture, already we know that, isn't it? Pathological fracture. Okay, fine. See, Montagia fracture and Galecia fracture. What is that? Montagia fracture and Galecia fracture. Montagia, Galecia. Montagia and Galecia. What is Montagia and Galecia fracture? What is proximal? What is distal? Towards the body side is proximal. Away from the body is distal. Away from the body is distal. Ikkada chudu. Montagia. What is that? Montagia fracture. Montagia fracture is proximal ulnar fracture. Proximal ulnar. Ulna ekkada? Ikkada. Ulna ekkada? Ikkada. Proximal ante itu side. Distal ante itu side. So ikkada fracture ekkada? Ikkada. See, ulnar bone proximal side fracture and radial bone distal side dislocation. ఏమైంది? Ulnar side proximal side fracture, radial side distal side dislocation or bending or dislocation. That is called Montagia. Montagia. So Galecia opposite. Galecia ante enti? Galecia ante enti? Opposite. What is that? Distal radial side fracture and proximal ulnar side dislocation or bending. అర్థమైందా లేదా? Have you got it? Montagia, Galecia. Montagia, Galecia. Montagia, Galecia. Have you got it? Montagia in ulnar area, Galecia in radial area. So opposite. Montagia ante proximal ulnar area fracture, distal radial side dislocation. Opposite Galecia. Enti distal radial side fracture, ulnar proximal dislocated. Have you got it? Have you got it? Okay, Montagia and Galecia. Next one is Colles fracture. Colles. What is Colles fracture? Distal radial fracture with dorsal tilt. Dorsal tilt. What is dorsal? What is dorsal? This is dorsum. This is ventrum. Dorsum, ventrum. Dorsal tilt. అంటే ఏంటి? డోర్సల్ టిల్ట్. డిస్టల్ రేడియల్ ఫ్రాక్చర్ అయింది, అప్పుడు ఏం కూడా అయింది? డోర్సల్ టిల్ట్. డోర్సల్ అంటే పైన, పైన టిల్ట్ అయింది, ఫ్రాక్చర్ అయింది, టిల్ట్ అయింది. గాట్ ఇట్? లైక్ దిస్ బర్డ్. స్మిత్ ఫ్రాక్చర్. స్మిత్ ఫ్రాక్చర్ అంటే ఏంటి? ఆపోజిట్. Colles Smith. Colles Smith. Colles అంటే ఏంటి? ఫ్రాక్చర్ అక్కడ. Colles and Smith both కండిషన్. ఫ్రాక్చర్ అక్కడ డిస్టల్ రేడియల్ ఫ్రాక్చర్. డిస్టల్ రేడియల్ ఫ్రాక్చర్. బట్ టిల్టింగ్ ఎట్లా? డిస్టల్ సారీ డోర్సల్ అంటే కోలి సిడి కోలిస్ అంటే డిస్టల్ ఫ్రాక్చర్ డోర్సల్ టిల్ట్ సిడి. ఓకే, అండ్ స్మిత్ అంటే ఏంటి? డిస్టల్ రేడియల్ ఫ్రాక్చర్ బట్ వెంట్రల్ టిల్ట్. ఏం టిల్ట్? వెంట్రల్ టిల్ట్. ఎస్వి స్మిత్ అంటే వెంట్రల్ టిల్ట్, ఫ్రాక్చర్ ఎక్కడ? రేడియల్. ఓకే, అండ్ కోలిస్ అంటే సిడి, ఫ్రాక్చర్ ఎక్కడ? డిస్టల్ రేడియల్. టిల్టింగ్ ఎట్లా? డోర్సల్. అర్థమైందా లేదా? అది కూడా ఓకే ఫైన్. దెన్ బిన్నెట్ ఫ్రాక్చర్ ఎక్కడ? ఫస్ట్ మెటాకార్పల్. వేర్ ఇస్ ఫస్ట్ మెటాకార్పల్? ఫస్ట్ మెటాకార్పల్ ఎక్కడ? ఫస్ట్ మెటాకార్పల్ ఎక్కడ? దిస్ ఈస్ కార్పల్, దిస్ ఈస్ మెటాకార్పల్. ఫస్ట్ మెటాకార్పల్ బోన్ ఫ్రాక్చర్, దట్ ఈస్ కాల్డ్ బిన్నెట్ ఫ్రాక్చర్. ఫిఫ్త్ మెటాకార్పల్ ఎక్కడ? ఫిఫ్త్ ఇట్లా లిటిల్ ఫింగర్. ఫిఫ్త్ మెటాకార్పల్ ఫ్రాక్చర్ వాట్ ఈస్ కాల్డ్? బాక్సర్ ఫ్రాక్చర్. విచ్ ఫ్రాక్చర్? బాక్సర్ ఫ్రాక్చర్. అవునా లేదా? బాక్సింగ్ చేసిన టైంలో ఫ్రాక్చర్ ఎక్కడ? ఇట్లా. ఇది అవునా లేదా? సో దట్ ఈస్ కాల్డ్ బాక్సర్స్ ఫ్రాక్చర్. విచ్ కార్పల్? విచ్ మెటాకార్పల్? ఫిఫ్త్ మెటాకార్పల్. గాట్ ఇట్? లిటిల్ ఫింగర్ దగ్గర. ఓకే ఫైన్. దెన్ బంబర్ ఫ్రాక్చర్. వాట్ ఈస్ బంబర్ ఫ్రాక్చర్? బంబర్ అంటే అదే ఎక్కడ? ఆమ్లా లెగ్లా? లెగ్. అప్పర్ లెగ్ లోవర్ లెగ్? లోవర్ లెగ్. టిబియాలా ఫిబులా? టిబియా. విచ్ బోన్ ఇస్ టిబియా? విచ్ బోన్ ఇస్ ఫిబులా? Bigger and smaller. Which is tibia? Which is fibula? Tibia smaller bigger? Tibia big. Okay, and fibula? Tibia, fibula, two bones are there. Yeah, fibula smaller, tibia bigger. లేదా? కన్ఫర్మ్ చేయడా? టిబియా పెద్దదే కదా? అవునా? ఆర్ యు షూర్? ఓకే ఫైన్. సో tibial lateral condyle. Where is condyle? Lateral condyle. Condyle. If it is arm, this is condyle area. Okay, this is medial condyle, this is lateral condyle. And same in the leg and the angle. See, this side is lateral and this side is medial. Okay, suppose okay fine. So this side, this is a toe side, great toe. This is great toe side. This is great toe side. Okay, this is small toe side. So this side angle, this side, that is lateral condyle, and this side is medial condyle. So here bumper fracture ekkada? Lateral tibial condyle area. Lateral tibial condyle fracture ekkada? Ikkada. Got it? That is called bumper fracture. What is pod fracture? Pod spine is there. Pod spine. That is different, isn't it? Pod spine. This is pod fracture. Pod spine is in TB, isn't it? Pod spine in TB. Spine. Okay, fine. That is different. So here, pod fracture. What is pod fracture? That is this is the commonest question. Commonest questions are Colles fracture, Smith fracture, pod fracture, ఇంకా Montague Gillespie. These are the common fractures. Colles fracture, Cooley's fracture or Colles fracture, bumper fracture. Bumper is not common. Pod's fracture, Montague fracture, Gillespie fracture. Okay, these are the commonest questions. Fine. Pod's fracture, ekkada? Yeah, Pod's fracture, medial lateral? Okay, fine. Both are typed in same, right? Okay, it's a mistake. It's a mistake. No problem. Sports and a medial condyle fracture. Medial condyle fracture. Medial condyle fracture is sports fracture. Okay. So keep in mind PM. What is that? PM, not Prime Minister. Sports fracture, lateral condyle. Okay, lateral. Medial condyle. Medial condyle fracture. Then Jefferson's. What is Jefferson's? Jefferson fracture. Jefferson fracture, hangman fracture. Jefferson fracture, hangman fracture. Atlas bone, axial bone. Which is atlas? Which is axial? C1 and C2. Which is C1? Which is C2? Atlas is C1. Atlas C1. Axial C2. Atlas C1. Axial C2. Hangman fracture. Jefferson fracture. Jefferson fracture indicates murder. Jefferson fracture indicates murder. And hangman fracture indicates suicide. That's the difference. That is why this. That is how this forensic department identified this is suicide and this is murder. Isn't it? Somebody killed the person and hanging them. And hanging them. So what happens? What happens? What happens? Which bone will be fractured? First C1. C1 will be fractured. C1 will be fractured. That is called Jefferson fracture. That indicates murder. And someone is suiciding. Then C2. Atlas. Okay. Axial. Necron is axial bone will be, axial cervical 2 becomes fractured. That indicates suicide. M side? Suicide. Okay, fine. Got it? Fine. Okay, Montagia Galacia, already we discussed. Isn't it? Montagia Galacia. In X-ray, it look like this. Isn't it? Okay, got it? So, what are these bones? How many are there? Carpal. 8 or 7? 7. In tarsal? Tarsal 7, carpal 8. Carpal 8, tarsal 7. Okay, fine then. And this one, Galacia, opposite. Galacia opposite. Ikkada. Galacia ikkada fracture ayindi. See tarsal fracture. See, listen here. In Montagia, fracture ekkada? Fracture ekkada? In Montagia, fracture ekkada? Ikkada. These are tarsal bones. See, proximal. Ekkada fracture ayindi? Proximal ulnar. Okay, fine. And next, in Galacia, fracture ekkada? Distal. Got it? That is the difference. Already we discussed, isn't it? Fine. And Colles fracture. See, Colles and Smith. I got it? Ventral, sorry, dorsal, ventral. Dorsal, ventral. I got it? Colles. Got it? Outward. And Smith, inward, ventral. Ventral. And outward, dorsal. Okay? And this one is Binnett's fracture. Binnett fracture akkada? Binnett's akkada? Which metacarpal? First metacarpal. See the thumb. See, this is thumb. Metacarpal. Fracture akkada? Here the fracture. Can you see? Fracture. Ah, yes. Next. Boxer fracture. Ekkada? Fifth metacarpal. Boxers. By hitting. Isn't it? Fracture. Okay. Next one. Bumper fracture. Ekkada? Tibia. Medial, lateral. Okay. Then Ports fracture. Ports fracture. Got it? Got it? Next one, Jefferson. Jefferson and Hangman's. Which bone is this? C1 or C2? C1 or C2. Okay. There are different types: type 1, type 2, type 3. That is based on the area affected. It is not necessary. Okay. Atlas and axial. Next one, Hangman's, not Jangman's. Hangman's. Hangman's fracture. C2. Okay, C2. Got it? Got it? Got it? Okay. Fine. So what are the signs and symptoms? What are the signs and symptoms? Clinical manifestations, signs and symptoms. What are the signs and symptoms? There will be pain, swelling or tenderness, redness, then decreased movement, and then edema. That is what? Tenderness or edema. Then function will be impaired function. They can't move, isn't it? They can't move. They will hold it, isn't it? They will hold it. And the facial expression. Happy, eh? Oh my God. See, it will be something like crying, isn't it? Yes, their facial expression, isn't it? And bruising, and there will be numbness, tingling, because if there is compression of the nerve, so there will be paleness, and blood supply will be blocked, isn't it? And blood loss, isn't it? And vital signs will be decreased, isn't it? If there is blood loss, BP, takwa, heart rate, equa, isn't it? And the first stage and later stage, if there is more blood loss, entire thing will be decreased, isn't it? Hypovolemic shock, everything, and the extremities. If here is the fracture, the extremity, this side will be cool, isn't it? Due to lack of blood supply, isn't it? Okay, fine. Okay, fine. So what are the management? Yeah, first one is RICE. What is RICE? R for rest. I for cold application. I for cold application. Enduku, or ice application or cold application. Enduku, to prevent the edema or to stop the bleeding and to provide vasoconstriction. Analeda? Yes, and manage pain, vasoconstriction, to prevent edema and stop bleeding. Analeda? So for all these things, we will give ice or cold application, and C for compression. ఇప్పుడు bleeding ఉంది, ఏం చేయాలి? Pressure apply చేయాలి. And E for elevate. ఎందుకు? Return, venous return promote చేయడానికి. Then another strategies. What are the other strategies? Reduction. What is reduction? Closed reduction, open reduction. Closed reduction, open reduction. These are non-surgical methods. Closed reduction. Reduction. Traction, counter traction. Reduction is mainly for dislocation. Yeah, we have to make it in a proper alignment. ఏం చేయాలి alignment? What we have to do for alignment? ఏం చేయాలి alignment? Okay, just a minute. Excuse me. Class. Okay. ఎవరు? Okay. 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 Yeah, fine. Yes, reduction. What is that reduction? Displacement అయిన టైంలో ఏం చేయాలి? అది ఎట్లా? ట్రాక్షన్, కౌంటర్ ట్రాక్షన్ తెలుసా? ట్రాక్షన్, కౌంటర్ ట్రాక్షన్. pulling in opposite directions. Telsa leda? Telsu. Etla. Yeah. Yeah. Yeah, fine. So here we have here we have two gentlemen. Okay, we'll do traction. Okay, if do am he got a elbow dislocation. What happened? Elbow dislocation. Okay, fine. So this is the patient. This is the patient, and this is the nursing officer, and this is a another nursing officer. Okay, fine. So this is the person who are giving counter traction. What traction? Counter traction. This is the person who is standing here is giving the traction. What? Traction. So now here is the dislocation. Here is the dislocation. So what we will do, one person will hold the hand like this and pull this direction. How this person has to turn? Both legs are together. Both legs are together and lean back. Lean back. By holding this hand, lean back. So at that time, this person, what to do? Counter traction. This is traction. That is counter traction. Etla, yeah, see, give your both hands like this. Ah, yes, here, upper. Okay. So this person on the upper arm, pulling back against my pressure. I am pulling this direction. He is pulling opposite to my direction. I am giving traction. He is giving counter traction. So we will be, our position will be like this. Okay, legs are together and leaning back. Our spine should be straight and we are giving full force here. He is also giving the same position. Legs are together and leaning back. Like this we will pull it. Like this we will pull opposite direction. At that time doctor will do reduction. What? He will do correction. Got it? He will do correction. At that time, see this bone also we will pulling back and here also pulling front. So here there will be free space. That is a traction, counter traction. Then the doctor will correct it. Got it? This is called, thank you guys. Okay, fine. Thank you. This is called reduction. Non-surgical method. What is that? Non-surgical method reduction. Okay. This is of two types. One is open reduction, one is closed reduction. This is closed reduction. Open reduction means open, surgical, open it and they will correct it. Got it? Got it? Okay, fine. Then along with that fixation. What is fixation? Screw, plate, isn't it? And rods. They will keep rods, screws, and plates for what purpose? To fix it. To fix it. Got it? Got it? So these are the four strategies. What is that? Reduction, open reduction, closed reduction. Then fixation, internal fixation, external fixation. Then traction. Already we discussed now. Traction, counter traction. Then casting. What is casting? Plaster of Paris, isn't it? Plaster of Paris, casting, isn't it? Plaster of Paris, isn't it? Then it is synthetic and as well as fiber, isn't it? And POP, plaster of Paris. That we will do casting, isn't it? These are the four different methods. Okay, fine. And one is open and closed. Already we discussed, isn't it? Surgical, non-surgical. Closed ante non-surgical or manually chestaru. Every chestaru. Doctor chestaru. Nursing officers chestaru. Got it? As a teamwork, they will do it. That is what? Closed reduction. And if the patient is having pain, we will give local anesthesia. Only local anesthesia. Okay, fine. Then after that, what we will do? After correction, after reduction, what we will do? We will keep a plaster cast. We will keep a plaster cast for what purpose? To settle it down. Isn't it? To settle it for immobility. For what purpose? Immobility. Okay. So if it is happened one time, there is a risk for repeated dislocation. So what we will do? We will correct it and we will keep a plaster cast. Okay, fine. Then surgical management is open reduction. Is it open? We will surgically open it in the OT and we will place it. Got it? Fix it. Okay, fine. So this one, you know it. What is this? What is this? Screws and plates, internal and external fixation, isn't it? Plates and screws. Place chesara leda fracture lu, isn't it? Fine. Yes. See, plates and okay, plates. There are different different types. Based on the material, the plates and screws. Some of the screws or plates are so absorbable. Which are they? Absorbable. Absorbable ante remove cheyaledu. In 5-year time, it will absorb. So non-absorbable thing, what we will do in 2-year time or 3-year, after 2-year or after 3-year or after 5-year, what we will do? We will take it out. Got it? That is depending upon the material. Depends upon the material. Okay, fine. And then fixation. No problem. No problem. If it is there, no problem. Only thing is, after 40 years, 50 years, what happens? We will feel some pain. We will feel some pain due to demineralization. This plate will be, it is a material, but our bone is demineralizing. So what happens? There will be sticking. Okay, so we will feel some pain. We will feel some pain. That's it. So at that time, we can remove it. No issue. Okay, fine. So here, another thing is fixation. What are the fixations? Internal fixation and external fixation. What are these fixation? Screw, plate, pin, rod. Got it? All these things we will fix inside. For what purpose? To keep, yes, protection or stability. What happens? Sometimes bone will be fractured in multiple pieces. At that time, what we will do? All the pieces we will stick together and we will keep a long rod. We will keep a long rod or long plate so that everything will settle. It needs more time, isn't it? And in facial, axillary bone, what happens? Here we will keep a chain, isn't it? Suppose if there is here is a fracture, we can't keep a plate or screw, isn't it? Plate we can't do, isn't it? Or screw we can't do. We will keep a chain. Because this is moving. For chewing, we need the movement. For speaking, for talking, we need movement. Suppose if it is fixed, no movement. So we can do this, but we can't do we can't do e. Both we can't do, isn't it? And we can't even talk or chew. So there they will keep what chains. Okay, fine. Then external fixation. What we are keeping? Frames. Externally we are keeping frame. Which frame? Hollow traction. Externally there is a frame. Either a screw, pin. Isn't it? Fine. Then attachments like splint attachments, isn't it? Or very good, plate attachments, isn't it? Externally, not internally. Okay, fine. So these are external fixation, external pin, external screw, isn't it? Internal and external. There are two types of fixations. Fine. Tractions, examples, isn't it? Which are the tractions? Skin traction, skeletal traction. There are mainly two tractions. Which are they? Skin traction, skeletal traction. Right. Skin traction and Monica, years. It will take years. Screw or plate, either 1 year or 2 year. Sometimes in 6 months also it is removing. Sometimes it is not removing. Some dissolvable or absorbable screws are also there. Yes. After 4 years, it is easy. There is no much pain. We can remove it. Okay, fine. Then tractions. What are the common tractions? Skin tractions. So now I said when we were doing that reduction, we said traction, counter traction. Same like what happens here? Some fractures we will keep pins or screws, and what we need to do? We have to apply for longer time. We need to keep a traction force, pulling force. For a pulling force, traction force we need to keep. For that we are using weight. Along with pulleys. Pulleys and enti ikkada undi kada. Got it? To reduce the immobilization and to keep the pulling force or traction force, we are applying tractions. For example, which are the tractions? Example, skin traction, skeletal traction. Which are the skin tractions? I heard about Buck's traction, Russell's traction, halo traction, pelvic traction, Dunlop traction. Yes. So just go through the images. Just go through the images. In TSPSC, you won't get any images, but in AIMS exams, you will definitely get images. Most commonly asking image in AIMS exam is halo traction and Buck's traction. Buck's traction, halo traction. These are the two images most commonly asking in repeatedly asking in AIMS. Okay, got it? Okay, fine. Then cast. What are the types of cast? Okay, before that, one more important point. What is the maximum weight we can put in skin traction and skeletal traction? In skin traction, maximum weight 4.5 to 9 pound. 4.5 to 9 pound. Maximum weight for skin traction 4.5 to 9 pound. In kg? In kg? 2 to 4 kg. 2 to 4 kg or 4.5 to 9 pound. 2.5 to 9 pound. That is the maximum weight we can put for skin traction. So what is the maximum weight for skeletal traction? Skeletal traction. Skeletal traction. 9 to 18. 9 to 18 or 9 to 20 pounds. 9 to 20 pounds, or we can say 4.5 to 9 kg. 4.5 to 9 kg. 4.5 to 9 kg. That is the maximum weight we can put on. We can put on skeletal traction. Okay, and there are some restrict rules that never increase or decrease the weight unless there is a doctor's order. Never increase, never decrease, and don't keep the weight down resting on the floor. It should be hanging. It should be hanging. The weight should be hanging. Got it? Weight should not keep it in the down on the floor. No, don't keep it. It should be hanging. It should be hanging. Got it? Fine. Yes. So next one is cast. What are these casts? Cast. Yes, already we discussed, isn't it? Buck's traction, Russell's traction, yeah, cervical traction, pelvic traction, Dunlop traction. Okay, what is this traction? This traction, cervical traction. First one, cervical traction. Okay, it is not 300. It is 30 degree to 40 degree. It is not 300, 30 degree to 40 degree. 30 degree to 40 degree head and elevation. Okay, got it? Okay. Okay. So Dunlop. Okay, cast. What is this cast? Cast. Cast. Yes, after reduction. After reduction, to keep the part immobilized. To keep the part immobilized, non-movable, immovable. It should be kept at a resting position. Immovable, immobility. We will keep cast, and to promote healing. To promote healing and to maintain alignment. To maintain alignment. For everything we are keeping cast. We are keeping cast. What are the type of cast? Type of cast. Type of cast. POP, synthetic and fiber. Fiber, synthetic fiber and POP, plaster of Paris. And what is the time required for drying? Dry. Dryness. For POP, 24 to 48 hours. That is 1 to 2 days or 1 to 3 days. 1 to 2 days or 1 to 3 days. That is that much time needed for POP, plaster of Paris, for entire dryness. For synthetic fiber, only 20 to 30 minutes. Only 20 to 30 minutes. For synthetic fiber, what is the time required for dryness? 20 to 30 minutes. 20 to 30 minutes. Okay. Fine. Then, what are the instruction for plaster of Paris? If we put not too tight, not too loose, then advise them don't use fingers, or sometimes what they'll do, scale or some sharp anything, because if we don't bath for 2 or 3 days, what happens? We will feel itching. So same it is for longer days, is it 2 weeks, 3 weeks? So obviously after 2 day or 3 day they will start itching. What they will do? Isn't it? They will keep a scale and isn't it? Itching and pleasure, isn't it? That feeling, isn't it? Don't do that. Why? Why? If they do, there will be injury. There will be injury. If injury happens, what will happen? It is entirely closed. There is no contact with sunlight. There will be infection. There will be infection, and that infection spread to deeper side, and even bone becomes infected. Isn't it? Okay, fine. So don't do that. Is it? Don't do that. Okay, fine. And even sometimes they will go with this plaster. With the plaster, they will go for cricket playing, isn't it? With that, they will do boxing. Children, they will do it, isn't it? So everything should be avoided. Okay, fine. Then always they have to wear sling, isn't it? Arm slings. Okay, fine. Slings or sling support. Sling or sling supports. Okay, fine. Okay. So what are the complications? What are the complications? Complications. Yeah, first one is yeah, fat embolism. Fat embolism. What is fat embolism? Fat embolism. The cholesterol tissues or adipose tissues or cholesterol tissues, it will move from one area to another area. It will sediment and it will move due to lack of mobility, due to prolonged immobilization. What happens? These fats or these adipose tissues will be sedimenting, settling, depositing, and from there it is moving. Simply that is called fat embolism. Moving plaque or moving adipose tissue. Got it? Okay, fine. Epudu? Yeah, after 2 to 3 days. After 2 to 3 days, there is a risk. There is a risk for fat embolism. So what are the signs and symptoms? There will be pain, swelling, tingling and numbness. And more preferably, what is the ideal or more, what is the priority sign ante? Coolness, diminished pulse and discoloration. These are the important signs. Which are the important signs? Peripheral area, distal or peripherally blood supply decreases, so it becomes discoloration. First it becomes pale, then it becomes bluish, palish, bluish. What is palish and bluish? Then diminished pulse and coolness. If there is no blood supply, it will be cool. Blood ledante cool ga undi. Got it? Fine. Then what are the other symptoms associated with fat embolism? Fat embolism ante from the periphery, this clot or plaque move from that area and reaches to pulmonary artery. Through the peripheral vein, it reaches to inferior vena cava. Through inferior vena cava, it reaches to right atrium to right ventricle to pulmonary artery. There is obstruction, pulmonary artery obstruction, embolism, pulmonary embolism. So it will lead to cardiac failure. Pulmonary embolism leads to cardiac failure. Got it? Okay, fine. So a patient may develop restlessness, hypoxemia, tachycardia, dyspnea, hypotension, everything related to cardiovascular. Everything related to cardiovascular. And we have to give oxygen management, IV management, and we have to intubate the patient along with cardiac monitoring. Cardiac monitoring. Then we need to go for embolization. We need to go for embolization or embolectomy. Embolectomy or embolization. Embolectomy means we will remove the embolus, and embolization means we will dilute. We will break down the emboli. Got it? Okay, fine. Next one, next and most dangerous